So yes, as Letna was saying, I'm a professor at the University of Essex, where I also direct the Center for Research in Economic Sociology and Innovation called CRESI. So I'm very interested in some of the political economic dynamics that have to do with large philanthropic actors like the Bill and Melinda Gates Foundation and how they influence priority setting in global health. I wrote a book in 2015 that was called No Such Thing as a Free Gift, The Gates Foundation and the Price of Philanthropy. In this book, which was published with Verso in 2015, it was written at a time when there really was not a lot of concern or debate in global health about the pros and the cons of having a large actor like the Bill and Melinda Gates Foundation playing a role in priority setting in global health. So when I wrote that book, there was really a lot of fanfare and a lot of public regard for someone like Bill Gates. And I didn't completely disagree with all of this regard. I thought that he in some ways was quite well-meaning and that he was trying to do some good things with his money. But I also thought that there were a lot of questions that needed to be posed of the problem of one individual in particular having the capacity to essentially influence decision-making at organizations like the World Health Organization. So I set out really in my postdoctoral project, which I know some of you are doing PhDs, so you'll know that the process of trying to find a research problem or question can be quite painstaking in ways. And after I'd finished my PhD at the LSE in 2008, I had a postdoc at Oxford from 2008 to 2010. And this project that eventually became the book about the Gates Foundation was really my postdoctoral project at Oxford. When I worked at the business school, the Said Business School, for a couple of years, and it was while I was working at the business school that I saw that there was a lot of fanfare and excitement over a phenomenon that came to be known as philanthrocapitalism. And so I'll describe in a minute essentially what that is and why there was a lot of interest in philanthrocapitalism at the business school. But also I was very skeptical about some of the ideas being espoused in this new philanthrocapitalist movement. And I came at my concerns from a history of activism and travel and development work, essentially development journalism work in developing regions that I had done, not for too long really, because I started my PhD while I was quite young, but certainly I'd been an activist for quite a few years when I was working on my own undergraduate in Canada. And I was very concerned with especially things like intellectual property protections and trade laws at places like the World Trade Organization, which many people back in the early noughties, the early 2000s, when I was doing my own undergraduate degree, many people at that time were very concerned about patent laws that made it hard for poor populations to access generic medicines. So when I got to Oxford in 2008, the idea that Bill Gates, who many people in my world of activism saw as quite a monopolistic figure, the idea that this monopolistic figure was some sort of savior of the world was very surprising to me. And I started to try to write about that tension. So fast forward to 2020, 21, when the pandemic hit, some of Gates's actions actually led him to be then really vilified as almost an evil figure. And I don't personally subscribe to a lot of those conspiracy theories. I think they're very extremist, and I think they make false claims about Gates. But I am, as a social theorist, interested in why he essentially went from essentially being perceived almost as a saintly figure to being seen as almost a monstrous figure. So that's what I'm going to talk about in this talk. And I think it has to do, to a large degree, with some shifting understandings of the viability of the sort of harmony of interest narratives that he tried to propagate through his work at the Gates Foundation. And by a harmony of interest narrative approach, I mean his suggestion, his stated claim that the interests of business naturally align with the interests of public welfare. Okay, that's the harmony illusion or the harmony narrative. And that claim that he made is actually not in any way a new one. It harks back to really 18th century political economic perspectives espoused by people like Adam Smith to a large degree. But for a long time, it was seen as a very implausible narrative, and he helped to sort of romanticize it. And I want to talk about that, how he helped to romanticize it, and then how his attempt to romanticize it was essentially exposed as being problematic by some things that happened in the COVID pandemic. So that will be the trajectory of my talk. So you'll see this picture, I think, here. And what it is it goes back to a media article that was published in The Guardian in 2015. And this was at the time of Gates's birthday. And at the time, some school children in India, in Chennai, were sort of hustled into a courtyard, and they were each given placards with sort of Bill Gates's face as a sort of homage to Gates. They were asked to sort of wave the placard and say, "Happy birthday, Mr. Gates," in front of this huge floating, massive placard of Gates that says, "Grow rich, help others." Okay? So this image, which I think is quite an almost hagiographic image, okay, because it's quite a worshiping image. It shows that there was in 2015 a general reverence for Gates, which I argue would be encapsulated by this photo, which shows school children saying happy birthday to Gates back in 2015. So it's quite a saintly image of it, I would say. And this idea of grow rich, help others is really the defining maxim behind what came to be called in the late noughties philanthrocapitalism. Fast forward 6 years later, and you see on Twitter, after Gates was began to receive a lot of negative press for some of his actions around patent protections and his fierce defense of patents at the time of some efforts by the WHO and elsewhere to try to call for a patent waiver, you had suddenly, in ways, and the switch I think really was that quick, you had suddenly Gates vilified as a monster, okay, as this it's a lefty press in the United States, Haymarket books, but essentially Bill Gates is a fucking monster was a far cry from Bill Gates is a saint, let's revere him here. So I want to try to, as I say in this talk, theorize how and why that happened. Well, I think in order to do that, you need to go back and look at some of the hype surrounding Gates Foundation disbursements. So a lot of this talk will really be looking at the Bill and Melinda Gates Foundation and looking at some of its disbursements over the years and how there was both hype and eventually a need for a sober realization that some of the hype surrounding their disbursements were not really as of such a magnitude they were sometimes assumed to be when you look at the Gates Foundation's distributions compared to governmental outlays towards development and global health, okay? So in essence, the Gates Foundation, its outlays towards development, including health and agriculture, it can spike in different years. It depends really on the size of its endowment, which fluctuates up and down with the health of the stock market. But it broadly hovers at around $2 to $3 billion every year. Okay, I'm using US dollars for these figures. Whereas spending on overseas development aid by the governments of the OECD cumulatively, and this is actually quite a low estimate because I've been giving a version of these slides for a few years, and I have updated them, as you'll see on my next one, but not all of them are as updated as I might like them to be. But so this has probably gone up a bit in recent years, but cumulatively by OECD countries, so not counting countries like China, which are not a part of it, it hovers at 132 billion each year by governments. Okay, and this figure does not take into account ODA distributed by China, for example, and other non-OECD countries. So the Bill and Melinda Gates Foundation has donated about 65 billion in total. When you look at 23 years times 3, you get this broad sum. Okay, that's its total expenditures to date as of 2021. And across all of its priority areas, and that's including global health. So I would put the global health figure, it's been a while since I've tabulated the grants exactly, but around 30 billion. And if you compare that to what wealthy nations give, it's really a drop in the bucket compared to spending by governmental actors like the US, for example. So to give just one example, I was curious what recent figures were when it came to HIV disbursements by the federal US government. And it's actually in 2019 alone, as this source details in more depth, it was 34.8 billion for 1 year alone. Now, only 19% of that, or 6.8 billion, was spent on global efforts. The vast majority, okay, is spent domestically on trying to provide support to HIV sufferers in the US. And so 6.8 was earmarked for HIV globally in 2019. But you can see that simply for one sort of virus, one disease, you've got this amount of 6.8 spent federally by the government. So as you can see, that really dwarfs all of Gates Foundation's outlays for global health combined, and that's just talking about HIV spending and research. And yet at the same time, the Gates Foundation has scope to direct its money in a targeted way to initiatives that it likes. And it's good in a way that it provides support to the World Health Organization. But a fairly small amount actually enables it to have quite a large footprint of the WHO, because it gives around $500 million annually to that organization. And that actually amounts to 10% of the World Health Organization's overall budget. They are not really a large organization when you compare their size to like a major medical institution in the US. WHO's operating budget is actually comparably a lot smaller. So because it can use US purchasing power in targeted ways, it can have a lot of clout when it comes to its overall percentage of an organization like the World Health Organization's overall budget. And this arguably, it's very hard to get people to go on the record with you, although I did have a few in my book, I detail them, talk about the concern at the WHO that this was distorting different priorities and making the WHO too accountable to one private individual. Let's look at health spending overall too, because I think this is a very important figure too, when you look at the fact that when we talk in general about overseas development assistance for health, we don't want to give the impression that Western nations in general are some sort of saviors who overall outspend countries themselves in middle income and low income regions. Because with the exception of some very low income nations, the vast majority of health spending for global health and for domestic health resources in developing regions comes from governments themselves, as well as some user fees, so out-of-pocket private payments or different types of private payments. So this is a very, I think, good breakdown of the funding that goes to global health, and it's provided by a Gates recipient itself, which is the Institute for Health Metrics and Evaluation based in the University of Washington in the past. I'm not sure if they're still there recently, but they were until recently, and they received a lot of Gates money over the years, but that still seemed to not bias them towards giving a very clear picture of health funding overall. So I'm just going to briefly read this out because I think it's a very important slide for understanding health spending. It's from 2018, but it's relatively current. Of worldwide health spending, 74% is financed through governments, 18.6% spent out of pocket, 7.2% financed through private insurance, and only 0.2% financed by donors. So that really shows that the vast majority of health financing comes from governments themselves. And yet again, because of the purchasing power really of that sort of 1%, it does mean that on health spending in low-income nations, this 1% becomes overall quite a big chunk of their budget because it makes up 25% of health spending in low-income nations, where 9.6% of the global population lives. So it is true that that corridor percentage is quite a big amount. And so we're not talking about negligible money, negligible effects. But when you compare it to overall health spending, the picture you get is one of government sort of activism, government interventionism, not this idea of private saviorism by philanthropic actors. So again, I think that 0.2 figure is a really good figure to bear in mind when you look at overall spending flows. So Does the Gates Foundation really like to talk about this reality? Does it talk about the fact that most of the vast majority of spending for health comes from governments themselves? Well, it doesn't deny it, but it doesn't exactly propagate this impression. When you look at its annual letters, there's often this impression of, we did this, we did that. We helped to reduce malaria incidence overall. We helped to lower childhood deaths for under fives. And that is quite clear when you look especially at something like the 2017 letter from the Gates Foundation, where they were asked sort of by Mr. Buffett, the billionaire head of Berkshire Hathaway, who really gave the Gates Foundation half of its overall endowment. They were asked by Buffett to reflect upon their accomplishments to date. And like any foundation, it's very hard to show causality because so many extra variables can affect whether or not you see positive health outcomes or negative ones. To the same logic, it's not fair to say that the Gates Foundation is responsible for all negative developments in global health, just like we should caution ourselves from assuming that they're responsible for positive outcomes. So, but the concern is, and I think this is an ideological concern because it gives the impression of private sector entrepreneurialism and creativity and dynamism that the government sector purportedly lacks when they claim that they themselves are responsible for a lot of major health outcomes. So in their annual letter, they will speak a lot about health outcomes and give the impression that they themselves were the causal determinant in improved outcomes, even though these outcomes are attributable to a vast array of different factors, including just, for example, overall GDP growth in a country like China is probably one of the massive causal reasons for improving under 5 deaths globally in the world since the 1980s, okay? And that's an article that's a point that's made by The Economist in this 2012 article. Aid itself does not seem to have been a decisive factor in cutting childhood mortality. Economic growth more broadly is. And so when you see that aid itself is usually not the main causal factor leading to a health improvement, the idea that the Gates Foundation would be the major causal factor when its own expenditures towards global health is really dwarfed by aid spending by governments, it's just almost outlandish to think that they are responsible for some of the health gains that we've seen worldwide over the past 20 years. Have they helped in some cases? Yes. Have they possibly harmed? Yes, too. But again, to measure harm, as anyone who does any sort of epidemiological work will know, is often harder than to measure positive effects, partly because researchers aren't always looking for harms, whether it's at the level of an epidemiological study or randomized controlled trial. Rare effects are hard to sort of account for when it comes to research design. So negative externalities are very hard to prove causally across many different areas, the social sciences and the natural sciences. So what to make of this? I've already spoken for quite a long time and I want to try to come to an end in the next 15 minutes, 10, 15 minutes. So I now want to shift to what this means when we think of things ideologically and what this type of claim sort of causal influence does when it comes to wider perceptions surrounding governmental ineptitude and governmental sort of governmental blame for different things, as well as governmental liability for good outcomes as well. So I would argue, and I do argue in my work, that the Gates Foundation plays a role in contributing to a normative and an ideological assumption that problems in our world stem from government failures and that the success of private actors helps to provide this sort of lionizing effect where they become the heroes of the world. And this helps to command more ideological support for ever more government and corporate enrichment, by governments often. So it helps to make the claim that the best way to get the job done is to outsource something to the private sector. And I think that claim has helped to galvanize different initiatives over the past sort of decades surrounding any number of different types of outsourcing developments. When you look at things like the Washington Consensus, where privatization was the name of the game, to public finance initiatives, which are one of the public-private partnership models, which argue that outsourcing different government services to the private sector will lead to efficiency gains overall. That's been really belied by evidence about just how costly different partnerships actually have been for government. And also, another thing that frustrates me with the Gates Foundation is when they hail different global health wins, they'll often talk about developments and say, Western nations while neglecting innovations in Southern regions. So they perpetuate this sort of epistemological assumption that the best research happens in the global North. And not only do they perpetuate that epistemologically, ideologically, they help to make it performatively as true as they can by directing the vast majority of their grants to already wealthy nations and already wealthy research institutes in the global North. Okay, so there's an ideological problem, there's an epistemological problem, and there's a resourcing problem. Why? Why does Gates do this? Well, I've studied his rhetoric, I've studied his speeches a lot over the years, and I think he does it. This is going to sound maybe surprising. I don't think it's because he's evil. I think it's because he is naive. I think he's not nearly as well read as he thinks he is when it comes to the history of capitalism. I think he genuinely thinks that the private sector is the savior that he feels it to be, and that he thinks that corporations have a strong role to play in developing good outcomes. And I think whether because of deliberate blindness or just genuine ignorance, he's not interested in seeing some of the negative externalities of corporate involvement in health. He doesn't understand the pricing concerns. He doesn't understand the incentive to drive up costs of prescription drugs and other interventions. He just doesn't get it. I think he is, frankly, too naive to understand that corporations and public welfare don't necessarily go hand in hand and both have the same harmony of interests at heart. He is convinced that they do, that there's a harmony of interests between the private sector and overall society. And over the years, you can really see this in a lot of his speeches, where ideologically, he constantly defends things that he terms phrases like creative capitalism. Whereas he called it back in the 2008 speech, it's an effort to stretch the reach of market forces so that more people can make a profit or gain recognition doing work that eases the world's inequities. So he feels that if you just bring the market to corners of the world where the market forces are less pronounced, less pervasive, then you'll have solved the problem of different types of poverty and inequality. He doesn't get that by actually enriching some people, you perpetuate the very inequalities that you claim to be solving through your philanthropic efforts. I don't know why he doesn't get that. He's supposed to be quite a brilliant individual, but he either just can't get it or doesn't want to. And yet, in many ways, it's not a new claim either. So it's a concept, this idea that we can marry the goals of private enrichment and public welfare is quite an old concept. And it goes back to really du commerce notions that were starting to emerge and become more pronounced in the 18th century. When people like Adam Smith started to draw on the ideas of earlier scholars like Vernon Mandeville, who really started to shift discourse more broadly away from the prior, very religion-influenced notion that some type of commerce is in itself venal or sort of immoral, okay? And Smith was at the forefront of arguing that that's not the case, that some types of private enrichment can be good for creating more dynamism when it comes to overall public well-being. And that led, of course, to his famous text, The Wealth of Nations, where he argued that a degree of private enrichment and private marketeering and trade can be good. Now, Smith, importantly, had a lot of caveats on that in his book. He argues against usury. He argues against extortionate interest rates. He demands different types of equality that are ignored by later interpreters of Smith. Gates, on the other hand, has never been actually as insistent on the need for checks on usury, for example. So Gates has actually adopted a far more capitalistic model of public-private interaction than Smith himself defended, which is sort of a longer point we can come back to in the discussion period if necessary. But just to say that this long history of deux commerce sort of notions is hardly new, but for a very, very long time, it was held in check and kept in doubt by different opposing frameworks from Marxist scholars and other critics of capitalist growth, who pointed out that the private sector, left unregulated, will lead to enormous death and evisceration and expropriation from the most vulnerable. Okay, so the deux commerce notion, not new, but hardly was the predominant paradigm really until recently. And recently, for a number of different reasons, the end of the Cold War, the seeming triumph of the capitalist model, the end of a seemingly viable alternative in socialism, you came to see a lot more of a pronounced triumphalism around the idea that capitalism is the only game in town and that we should laud its capacity to create more dynamism. And so by the 1980s, there started to be a real revival of deux commerce notions by people who were often based in leading business schools like at Harvard, where essentially influential management theorists like Michael Porter and Mark Kramer really started to champion the idea of shared value, which is the idea that there is a natural alignment between private enterprise and public objectives. And this led to a real entrenchment and normalization of the belief that private wealth inevitably fosters public benefits. And also for 3 decades, you started to see a lot of corporations capitalize upon this new ideological defense of corporate sort of beneficence. That's where Gates, I think, came in. He wasn't exactly outlandish for arguing that creative capitalism should be defended. He was drawing on the earlier ideas of people like Michael Porter and Mark Kramer. That was really the dominant paradigm from the 80s through the 90s until a few different factors happened that cast doubt on that new narrative. I don't have time to go into all of them, but I think you'll all be familiar with them. We can start with 2008, the financial crisis, the near collapse of the global stock market to almost the same degree and magnitude of, say, the stock market crash of 29, which led to a massive depression, and in our case was really only staved off by a lot of government intervention. The financial crisis was the sort of first bucket of water, dousing water upon the triumphalist narrative of people like Mark Kramer and Michael Porter. Then 2013, 2014, Thomas Piketty published his massive and very influential book on inequality, where he pointed out that returns to the private sector are not necessarily neutral or beneficent, but can actually starve the public sector of its own growth and its own resource base. So he really encapsulated that by his very infamous sort of theorem of R is greater than G, and R represents private returns to industry and G represents overall national growth levels. And this led him to argue that the vast returns to private recipients was starting to really explode at a time when national growth levels were stagnating. And this again sort of started to cast doubt on Gates's claim that giving non-repayable grants to companies is intrinsically good in itself, because that was another phenomenon that had developed under the Gates Foundation that was only for a while attracting a tiny bit of criticism from, me and some other very, more influential figures who were writing very good work on this, like David McCoy, who published a very good piece in The Lancet with a number of co-authors. And so I had questioned some of these grants going to wealthy companies, and I'd questioned their legality. But for a long time, I was sort of seen as almost an outlandish critic because I felt so in the minority for some of the claims I was making. But later, the criticisms I was making were reiterated and drawn upon by people like Tim Schwab in The Nation, who also started to question the magnitude of the gifts going to industry. So I've only got around 3 more minutes because I really want us to have some time for discussions. So I'm going to start to come to a close, but I hope in general I've managed to give a little bit of an overview of this shift that has taken place, where you have a figure like Mr. Gates in the 80s, 90s, largely denigrated and seen critically as a monopolist in the tech sector. Then he starts to burnish his image through a lot of grant making to good causes in the early 2000s. And so for 20 years, he really has been on this pendulum trajectory where in the 80s and 90s, he was criticized a lot. When he started to give away a lot of his money towards good causes, he became almost a saintly figure. But then when we realized that some of the purportedly good causes he was giving his money to was actually often in the form of many non-repayable grants to some of the world's wealthiest corporations, this rightly began to anger people. So the vast majority of Gates Foundation grants do go to nonprofit recipients, but a good chunk also goes to some of the world's wealthiest corporations like MasterCard in the form of non-repayable grants. At a time of such growing inequality and renewed, certainly relative poverty, and some people would say absolute poverty has not improved nearly as much as some figures favored by the World Bank would suggest. So at a time of gross poverty, extreme growing relative poverty levels, and in many places a return of sort of worsening absolute poverty levels, people are starting to sense that this hope of enriching companies in order to do good might not be the panacea that Gates held it up to be. What really compounded that was not simply the financial crisis, not simply important work like Piketty's Capital. What really compounded impressions of sort of the negativity of a figure like Gates having so much influence was obviously the COVID pandemic. Because it was then when you saw clearly that there was a struggle in developing regions to access many of the therapies and the vaccines that they needed. That is when you suddenly really started to have this rejuvenation of this presumption that, well, he's almost a monstrous figure, which I don't agree with myself because it's too extreme in the other direction. But I think sociologically, you can understand where this anger has come from. And it's come from people across the world who are frustrated by the reality of vaccine imperialism and the fact that so many global populations are reliant on a handful of for-profit multinationals to make available vaccines that are largely funded by public money to begin with. So I think this is why so many populations are increasingly angry at the Gates Foundation. Another phenomenon, which I don't think I have enough time to go into now, because I'd like us to have some time for discussion, is the problem of domination through debt. Okay, and this is the focus of some new work that I'm developing right now that I hope to have an article out about in the next year or so. It will not focus specifically on the Gates Foundation, but it will focus on domination through debt in different ways, building on earlier scholars like Graeber, but also contesting some of their theories. David Graeber, who wrote a very influential book called Debt, the First 4,000 Years. So what's happened today is that it's become more apparent to a wider public that the Gates Foundation often ignores evidence of the harms of a very pro-West oriented intellectual property regime. We know that calls to adopt a patent waiver were never successfully adopted worldwide, despite a lot of effort by global South nations to push for a vaccine waiver. That proposal failed. Largely now, vaccine access to COVID vaccines, it's not as big a problem as it was in the early years of the pandemic, but we're going to see this problem come up time and time and again as the same cycle happens of countries in developing regions being incapable because of the legal threat of a possible viable legal challenge being mounted under WTO frameworks against any generic manufacturer that tries to produce drugs domestically. They expose themselves to endless litigation by very, very powerful and well-endowed pharmaceutical companies who, despite there being some sort of availability through TRIPS under the WHO to allow for the commissioning of generic medicines in health emergency, in truth, any country that really tries to is put on a sort of watch list by US agencies. You're really exposing yourself to a lot of legal threats, and a lot of countries just don't want to run that risk, okay? We could talk a bit about that in the question period if you'd like, but there's some real bullying tactics that still go on by the EU and by the US federal government when it comes to trying to defend the patent regime that really militates against the availability of medicines worldwide. So to conclude, for 20 years, Gates personally and the Bill and Melinda Gates Foundation as an organization has really, in both practice and theory, defended a very restrictive, very global north-serving international patent regime. Today, fractures with that approach are becoming more perceptible as a result of the COVID-19 pandemic making visible these long-standing problems. It wasn't that the problems didn't exist before, it was that they were less visible than they became. And though I don't support the conspiracy theories which vilify Gates as a monster, I think sociologically they are comprehensible and they need to be understood as a type of logic, however irrational. It's a type of logical manifestation of frustration over corporate non-accountability and the problem of wealth concentration in our society today. Thanks.